من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين. My dear students, fellows and friends who are interested in this series of lectures that I was previously talking the session 1 of what is called as the dermatological manifestations of systemic diseases. The topic is very important as by learning of these manifestation you can number out or you can make a peripheral stigmata of the specific disease, which is a systemic disease. In session 1, I have talked something about the connective tissue disorder, although all connective tissue disorders were not taken by me previously, because this is just the examples of it. In the same time, the example of what is called infections and the dermatological manifestations. Okay, this is also a limited one because a lot of infections are not covered in this. For example, in cases of the meningococcemia, for example, there is a hemorrhagic type of a rash all over the body, dengue fever, yellow fever, and other ones. Only very, very specific type of diseases are taken, like for example tuberculosis. Now, tuberculosis, the mode of inoculation has been described. It may be a posibasillary, means that if you biopsy the specific target lesion, you will not find the AFB in this, or sputum is negative, posibasillary. And the lesion will be there, but they are so much scanty one that they cannot be detected as AFB positive, or it is the very least chances. Otherwise, the bronchoalveolar lavage can possibly display the acid-fast bacilli. This type of lesion are called posibasillary type of tuberculosis. A direct inoculation, for example, a touch from one human to the other or animal to the human, that is called the zoonotic. What you find is that the warty tuberculosis, that verrucola cutis, that is, warty type of excrescences are seen on the skin, and is a localized one. All regions, they are, because of the patient is experiencing first in his life, they are a primary type of tuberculosis. Or if it is not like that, it may spread to the one point to the other point, that the hematogenous spread. You can find the lupus vulgaris. If there is specific lesion of tuberculosis, you can say lichen scrofuloscorum, which is seen in other lesions also, other mycobacteria also, although a nodular tuberculoid type of lesion, nodular lesion possibility, and erythema induratum, means that it is a coin-like lesions and the indurated type of the margins is there. Now, it is the posibasillary. In addition, it is not written here, it is erythema nodosum also. So, erythema nodosum is a very important primary type of tuberculosis, where the biopsy specimen are negative. And it can occur in many, it is not specific to the tuberculosis, although, anyway, it is a primary inoculation, tuberculosis chancre, for example. This is a chancroid lesions, just like syphilis. That is, it's made from the brownish papule nodule to an ulcer with undermined H. This is undermined H. And on a diascopy, it shows the apple jelly nodules. In the diascope will be, it is an instrument. The light is thrown out and you see this mirror, convex mirror. Then you find that the apple jelly nodules are present inside here. It is a macroscopic type of examination. You see like this. Although lesions are this one here, also these are the lesions which describe this one. This is a lesion which is seen here for the same primary inoculation is concerned. About the warty tuberculosis, the verrucola cutis lesions occur on the area exposed to the traumatized area, and then the inoculation occurs. It will turn out to be a warty type of a tuberculosis. So, a very important differential diagnosis will be for any, herpes type of infection or a viral infection. It is possible like this. And another lesion is called the scrophloderma. Now, scrophloderma, a first bruised nodule, appear overlying the infected gland, for example, lymph nodes, and which breaks down to the undermined ulceration of the granulating tissue at the base. I have seen one case, two cases in my life, the scrophloderma, where the it spreads out on the skin from the lung, that is pleural tuberculosis. When it comes, when you know that there will be a pleural disease. It may be therapeutic it may be a diagnostic type of pleural disease. So it is possible that after take out that syringe after 2 or 3 days or 5 days, this type of a lesion appear at that site. I have seen 2 to 3 cases in my life, scleroderma on the chest wall. Now here, this is the lesion, an ulcerating lesion. Margins are very, very specific. You can see undermined ulceration. Granulation tissues are very, very prominent at the base, and bleeding occurs if it touches. It is biopsy different, even you will not find the AFB in this. Although histopathology will reveal the typical lesion of the tuberculosis. One specific lesion, lupus vulgaris. There are two types. The formation is plaque form, usually seen. I have seen these cases. And plaque means 1, 2, 3, 4. But it may be just like the whole limb is involved with these type of the plaques very near to each other. There is a nodular type of a form. It is something like this. Here it is present, and slightly here is also present. It is hematogenous spread. Another important region is erythromanodosum. You have learned about it many times in your life. And it is a very important region. It is a painful region. It is not, it is the patient may be present only with the erythromanodosum. While you are checking the erythromanodosum and examining the patient blindfoldly, then you can see that the possibility of the cervical lymphadenopathy in this patient, or in the cases of, you will see that this patient may be suffering from the perihilar lymphadenopathy. So this type of lesion, erythromanodosum, is seen only in primary tuberculosis, not in the secondary or post-primary one. It's less common there. It may be the presenting feature of the tuberculosis even. It may be the possibility. The primary tuberculosis occurs usually in children to young age, but it may occur at any time in the life. In Pakistan, because tuberculosis is so much common, the primary tuberculosis cases after 30 years are difficult to meet with. That is a difficult one. This is the lesion there, and it is the it is on the very near to it. We take this picture as closer magnification, and this is nodular lesion, and it is circumscribed and shiny skin over this. This is, and the Lewis response is seen. What is erythromanodosum? Delayed type of hypersensitivity reaction. The most often occurs with the erythematous tender nodules on the chins. Actually, the lesions usually occurs on the lower limbs and then upper limbs also. Etiology is manifold. One is the primary tuberculosis. If you neglect this, the other one may possibly streptococcal infection like the rheumatic fever, or other than that, it may possibility associated with nephrotic syndrome, or hepatitis C virus, Yersinia enterocolitica, can cause this type of a erythromanodosum. Drugs like sulfonamide, penicillin group, phenytoin, and the what is called as the antipsychotic drugs or over-the-counter prescriptions. It is possibly systemic, like sarcoidosis, lymphomas, lupus, erythematosus. It may be part of the inflammatory bowel disease, IBD. Epidemiology most common in women, the second to fourth decade. Clinical tender erythematous nodules on the bilateral shins, you will see like this, and possibly the infectious prodrome in this. Low-grade fever nodules is typically resolved without scarring after it is not, resolved by fibrosis. So the management is self-limiting NSAIDs, potassium iodide, corticosteroids, or specifically treat the conditions, mycoplasma or whatever it is. Now here you see the other lesions like vegetative form, whole nose, and then nodule, all. I mean, nodule may be hyperplastic and a tumor-like form can occur in the neck and other areas as well. It is the hematogenesis spread actually. First of all, and it is the delayed hypersensitization is on this type of lesion. And then you will see, again, this is another example of the scleroderma in this lesion. That is, this is the form, annular and plaque-like lesions on the different sides. And another lesion is a nodular form, seen here, because it is differential diagnosis list is manifold. It is not specific. Leprosy is the same one. It may be posibasillary, it may be multibasillary, whatever it is. It is its clinical type in tuberculoid and borderline lepromatous. Two ends are polar ends, and between this there are three things are important. I will discuss leprosy actually. Probably I have already discussed that when I have said there were infection and disease. And although these cases are rarely seen, but they are seen in Karachi. The lepra clinic is present in Sadr, Karachi, where a lot of cases are reported. Even they say that 3 to 4 per month. They are reporting they are positive reported. Test for the leprosy was positive, and their treatment are definitely done by the local government with the WHO help. They are managing the patient as the drugs as well as their socio-economical problems are concerned. So this is the actually comparison between the tuberculosis and lepromatous. I have already done it previously, but I was talking about infection and the disease. I don't want to discuss it now, but the thing is, this is the one. This is a tuberculosis type of the leprosy. You see like this on this part. You see on the forearms or on the near the fingers, and the chin, whatever it is, and it may be just see this very on a very close look. This is the possibility of the lesion of the tuberculosis type of lesion, possibility of like that. But actually, the differential diagnosis is always made by biopsy. You can see the characteristic histological feature. There is immune reaction is positive. Not only one peripheral stigmata is essential, but the other one as well. So the tuberculosis one and the it is the posibasillary, and then multibasillary is lepromatous. You see it is hematogenous spread actually. You find the whole of the limbs, they are discolored, anesthetic, etc. And the face are, hypertrophy and dystrophy, leonine face that is called. The leonine face, just like the Babar Sher, of course. Face is just like this, and nodules all over. Well, that condition is treatable, remember. It may be cured even if the proper guidelines are taken by the patient. HIV, there are a lot of peripheral stigmata or dermatological manifestations. HIV, some are written here, although the list is not complete. Seborrheic dermatitis, psoriasis, herpes simplex, viral warts, mollusca contagiosum, oral and vaginal candidiasis, scabies, squamous cell carcinoma, Kaposi sarcoma. But this list is not complete. Only few things are mentioned here. And there is severe plantar psoriasis. Patient previously had no psoriasis. Now there is plantar psoriasis. Shiny scales are seen here. And seborrheic type of dermatitis, weeping type, is seen here on the face. And you find the candidiasis, which is extending to the pharynx also. It is the age-defining diagnosis. And then we see around the eyes also here, you see. these lesions are present, nodular type of lesions are there. Here, this differently. Just like in this condition, also you find different. Kaposi sarcoma is the condition only seen in AIDS, and every part of the body can be involved. No part is exempted. This is the unique thing about Kaposi sarcoma. So it is a sarcoma. Sarcoma means that if they diagnose the definition previously was that it already metastasized. But in this condition, no. You can suppress this by different means. We'll discuss it afterwards. HIV is my favorite subject. Yeah, and I have already talked. I think in the previous years, many hours on this subject. And this is the few lesions which are very important to understand because they come in examination. They come to you as an infection, a disease, and the peripheral stigmata. Just for example, exemplifying these, few examples are given only. So it is you should remember these peripheral stigmata if you are interested in internal medicine. I will say internal medicine. I hope that this lecture will be beneficial to those who are preparing an examination and those who want to acquire knowledge. Knowledge, and knowledge is the power. وَمَا عَلَيْنَا إِلَّا الْبَلَاغُ.